Hey mamas, welcome to Breastfeeding Relief with Bethany. We share incredible stories, tips, and breastfeeding ideas to help on your journey. I'm your host, Bethany Laverne, a lactation consultant and speech therapist who helps mamas with breastfeeding. Not all breastfeeding stories are the same, and we dive into those topics. Hi, Lisa. Welcome to Breastfeeding Relief with Bethany. How are you today?
I'm fine. Thank you so much for having me.
Yeah, we're so excited to have you. So mamas, this is a little different today. So instead of talking about her breastfeeding journey, we're going to talk about tongue ties because we all know Bethany loves tongue ties. So why don't you go ahead and tell us a little bit about yourself and why you started your company?
Sure. So I am older than most of the people in the audience, I'm sure. I'm already a grandmother. So I worked for 28 years in hospital, first as a nurse, then as a midwife, got my IBCLC around the same time I became a midwife, lasted there for 28 years before I got very frustrated with trying to change the culture of the hospital. And maybe we'll talk about some of the obstacles that you get in the hospital when you're having trouble breastfeeding. Because I'm a pro at that, because that was what I was trying to help people, going against a culture that didn't believe in breastfeeding really, and certainly didn't support moms, and didn't like, having me around, because it would be like, oh no, put the bottle away, Lisa's coming, that kind of thing. So it was a little bit frustrating. So in 2015, I just threw caution to the wind and I left my position. Thank goodness my husband is extremely supportive, and was like, because I was making darn good money in a New York City hospital, doing what I was doing. And I'm like, I think I can do this. And I started an in-person practice for lactation support, for also well woman care, GYN, not catching babies anymore because it's hard to do that private practice in New York. And as that was going on clinically, I was seeing more and more families, more and more dyads that I couldn't help the baby with all the lactation tricks I had. So as a midwife, I totally believe in the least intervention in anything, the better, right? That's just the midwifery model of care. Let things be. So I had this block in myself saying, why would babies need a procedure? What is this tongue tie stuff? It's already, and this is going back like 15 years ago, already I was saying to myself, that doesn't sound right. So there's already that controversy in it. So this one mom came to me. I had seen her once. She came back to me and she said, you know what? I brought my baby to get his tongue tie clipped and things are almost better. I was like, really? Where'd you go? And then I started looking into where she went. I helped her with his new latch. Things were much improved. He transferred so much more milk. And that just started my journey. I wasn't automatically tongue tie experts. That wasn't my brand at first. That has evolved because I see the need for education, not just for moms and dads and families, but also for providers, for professionals in all walks of healthcare. So I like to say that my demographic is anyone who takes care of the breastfeeding, pregnant or breastfeeding family at any point, should understand a little bit about breastfeeding and at least recognize the signs and symptoms of tongue tie. So I've evolved my brand now to tongue tie experts, which I always like to explain. I don't mean that I'm the expert on tongue tie, because that sounds so egotistical, right? I mean that we're gathering the experts about tongue tie, and parents who are listening, who've been through tongue tie journeys, are the greatest and most important experts of all, because we're learning from the families, right? I mean, I'm sure you learned from your journey, right? More than you learned in a book.
Yeah, exactly. So, I mean, welcome to my platform, right? I don't want people to have the journey I had. And so that's why I'm sitting here today, helping other families to not have these experiences, that not realizing that because nobody was looking under his tongue, and said we had 3 pediatricians, they all would just depress his tongue. And even the physical therapist, the occupational therapist, nobody was checking on that until we finally saw a dentist that his tongue tie was related to late walking, his drooling, his bad sleeping, being up every night from 4 o'clock, his gagging, his trouble eating. My white bread kid is what I call him, right?
Yeah.
All associated with his tongue tie. And it was so hard for me. I felt like I kept looking for answers, and that was the answer. And so I just want other families to not have my journey, and just feel like they know something's wrong and they just can't find the answer.
Yeah. And talking about, my own journey, I always tell people I don't teach about breastfeeding because I did this all right. Sure. I mean, my kids are, they might be your age. I mean, my kids are grown up, right? Yeah. And I wish I knew what I know now when I was trying to feed my kids. The things I did, it was crazy. But better, you do better, right? Absolutely. So it's always like with each child, I did better, and thank goodness, guiding my daughter with my grandson, things are like ideally how I would want them now. But I always tell everybody, like 5 years from now, we might look back at this time and go, what were we doing? Because things change, right? Culture changes and stuff. But yeah, I really, that pediatrician visit, I think it's important to say that when the pediatrician is saying that there's no tongue tie, I like to empower parents to turn it around and say to the pediatrician, well, why do you think my breastfeeding isn't working?
Absolutely.
Like, there's got to be a reason, right? And usually they'll say things like, your nipples must be too small, or your milk isn't good, or flat, or what, all these things that are made up about women. But most of the time it's a baby issue, and as mothers, we always blame ourselves when things don't work with our kids. But, I've had women in tears in my office when I tell them, this is not your fault. This is nothing you are doing, because they're going crazy, trying to do everything, Googling everything, tracking everything, pumping, bottle feeding, using this, using that. Nothing's working. And I tell them, it's nothing you're doing. There's nothing wrong with you, and you're not doing anything wrong. But nobody has looked at the baby side of things to realize maybe the baby's not feeding efficiently for a reason. And one of those reasons is tongue tie. It's not always the reason, it's definitely not always the reason, but it's worth evaluating. For real evaluating. Right? Yeah.
Yeah. And even if you feel, I say to moms, if you don't like your first opinion, please go get a second opinion, because not everyone believes in tongue ties. Even I was talking to my uncle the other day, and he goes, oh, tongue ties are real? He goes, I thought it was just like a figure of speech, like you're tongue tied, the cat has your tongue. And I was like, no, it's real. Right.
So funny. Like it's a religion. They don't believe. And the other thing about any doctor you're seeing is we always forget that we've hired these people by walking into the office. And I say the same thing to my own patients. When you come to me, if I say something that doesn't feel right to you, use your instincts. And, you don't have to do what I say, because you can always go somewhere else. Like you've hired me, you've hired your doctor works for you. So if it's not working for you, pediatricians are a dime a dozen. They're all over the place. I went through 7 with my own kids, and that wasn't even breastfeeding issues. That was other issues. So, let them work for you. If they don't work for you, walk away. Even though I think a large part of the culture of why we feel intimidated in doing that is because most of the time we're not paying our pediatrician, the insurance is, right? So you feel you don't have that, like if you went to a restaurant and you ordered a meal and the meal was terrible, you would say something, right? Say you got a steak you couldn't cut. You'd say, I can't even cut this steak. What's going on? But because you're paying for it. But when the insurance company is paying for it, it feels indirect, and you don't feel like it's your place to complain about the product, if that makes any sense.
Oh, it makes total sense.
And that's just the theory I have. I don't have any evidence to back that up, but it feels like it just makes sense for the situation and your confidence level and not feeling it doesn't feel as transactional as like purchasing something, but you are purchasing that doctor's time. Yeah. And if that doctor isn't the right one, keep looking, because you deserve answers.
Absolutely.
You deserve answers.
And, just like nursing, just like speech therapy, we have big fields that we walk into when we walk into nursing school, when I walk into speech therapy school, right? And so I chose this path, but you also see speech therapists in schools. You see us in nursing homes. You see us in hospitals. You see us on ICU levels, right? And some people don't understand that, I've decided to take this avenue and work with kids and feeding and dysphagia and tongue ties, right? Just like with you. Whereas like my mother-in-law is a nurse, but she's worked oncology for years, right?
Right.
And so you wouldn't go to her and talk about a tongue tie because my mother-in-law has no idea she does oncology. Mm-hmm. So I love that you talk about, with the pediatricians, but let's talk even a bigger team approach. So then when we start asking for those referrals, who else should we be going to?
So I believe that if you have a question about your child's oral function, the first thing you should do is figure out the function that's not working and go to the specialist in that function. So for a breastfeeding baby, that's almost always the IBCLC. At least start with an IBCLC. For a bottle feeding baby, it could be an IBCLC, because we do take care of bottle feeding too, but it could be an SLP that has feeding training or feeding specialty. And then if it's an older child, like I get messages all the time on Instagram about older kids. And I have like just a disclaimer, like that's not my field. Just like I don't want a myofunctional therapist taking care of a 3-month-old. I wouldn't take care of a 5-year-old, even do an assessment on them, because I've not trained in the assessment in that child's age function. Right. So this is a diagnosis or assessment, because IBCLCs aren't officially allowed to diagnose. Right. So we call it assessment in the IBCLC land. It's an assessment of function, not of what it looks like. So you can't look at a tongue tie and say it's big, it's small, it's little, it's severe, just by looking at it. Right. And that's what I'll get somebody will come to my office and things haven't been good from the beginning. And the pediatrician said, well, there's a slight tongue tie, but it's probably not causing any interference. Like, well, did they watch the baby feed? So back to your, I always, and on my team, I have a speech language pathologist who I refer to all the time, and we refer back and forth. Like if she's got a case that's a breastfeeding age, even though they're bottle feeding, she'll, we collaborate. And then for lack of better words, body workers, such as physical therapists, occupational therapists, craniosacral therapy. In my ideal world, the baby will see a manual therapist before we consider release.
Yes.
Because for a few reasons. Number one, we want to make sure that the tightness under the tongue and the lack of optimum function isn't from somewhere else having tightness. So, the phrase is, if there's tightness somewhere, there's tightness everywhere. So if there's some torticollis, or the baby was like twisted in utero, or like in my grandson's case, his head, he was kind of wedged in, and I learned so much from my own grandson. He was in such a position that his neck was like tilted and on a slant, and my poor daughter had prodromal labor for 2 weeks. Oh. And when we saw his head, we knew why. He had like a crooked cone. Oh. And you could put him, and he stayed in the position he was in utero, and he needed a lot of work. I put her off and we had all of my team saw this baby, and, he went to the physical therapist, he went to the chiropractor, he had craniosacral therapy within the first 2 weeks, and then had a release at 2 weeks. And then continued with most of those therapies, depending on what she was up to at the time. Mm-hmm. Now, not everybody can do that. Not everybody needs that. Of course, right. My own grandson was one of the hardest cases I've ever seen. that's just, how it goes. But the ability to have relaxation of the body, tension removed, fascia release, and I don't know if you want to talk a little bit about what fascia means, is so important for the nervous system of the baby to adjust after the release. This isn't just like go for a quick snip, we'll snip it and everything's fine. That baby's got to adjust to having that release, to learning to move the tongue again, to use their mouth in new ways, to have control over that flow of the milk or work on the breast in a way that gets the milk out that they've never had before. So it's definitely a multifaceted approach. I like to think that the pediatrician and the OB are involved too. That's often wishful thinking. Honestly, so many of the people that come to me after the release, they come back and they say, you know what? My pediatrician didn't even ask me or look in his mouth, so I didn't even tell him, which is sad because then they don't learn that this is working, but.
Well, even with my pediatrician, after we had our sons revised for the second time and I went in, it was just our follow-up and it hadn't been too long after it was done. And I was like, oh, I'm so proud. And look how good his function is. And his tongue goes up. And she goes, okay. Like she just said, like, open your mouth. And then she was like, great. And I was like, you should look under his tongue. And she was like, I'm good.
Wow.
Okay.
Yeah. And of course, not the biggest, but one of the team members is the person for the release, right?
Right.
Which I prefer a pediatric dentist that uses a laser.
Me too.
Just in my own experience. But that would be whatever tool that provider is confident and experienced in using. So I've met docs who've lectured, at conferences who've only done scissor releases their whole career and are super confident and very expert at doing it with a scissor. But that's rare because most of the people that are doing this on any scaled basis, so having the most experience, usually invest in the laser because they're going to use the laser for other things as well.
Sure.
So it's worth that. And there's also different types of lasers, and the laser that, full disclosure, I lecture for one of the laser companies. Oh, cool. The CO2 laser is the reason I am associated with that company is because I've seen the difference in the types of laser releases, and that's the one that does the best job, has education along with it, has conferences, has multidisciplinary conferences talking about the team approach and not just clipping the tongue, and sending people on their way.
Right.
So,
yeah. And I love that because the first time our son got clipped, it was with a laser. Of course, we were not allowed to be in the room, which I was completely fine with. I was 4 days postpartum. But the thing I disliked the most, I wasn't referred to anyone. I wasn't told to go see anybody else. Right. He still had a ton of tension. We needed a ton of body work, which I didn't realize at the time. Again, you don't know what you don't know. Right. As a speech therapist, I only got 1 day of education, I think, of this in grad school. This wasn't something we were really taught, which sounds strange as a speech therapist because we're in your mouth all the time. We work on articulation. We work on tongue movements. We teach people how to eat, right? But with my son, one thing I look back now that super disappoints me is that pediatric dentist, no one in the office ever called me a week later. How's it going? Is everything going okay? How are the stretches? Even though I was given 2 stretches to rub my finger under his lip and then under his tongue. And that was it. Right. Wow. So like I was set up for failure from the start. Right. And it makes me really sad. I don't live in that town. I don't live in that state anymore.
I'm sorry that you had that experience. So I actually have a handout that I put together of questions to ask a provider.
Yes.
Before you even make the appointment. Perfect. So that you get some idea of, is this the right person to bring my baby to? Because especially, we're talking about people, like you said, you were 4 days postpartum.
Mhm.
What is your brain and your heart like at that point? You're not thinking very straight.
No.
I mean, no offense. I'm not trying
No,
to.
no, I wasn't. I agree.
I've been postpartum 3 times, and I know that those days you don't even remember. Like it's like a whirlwind. And yeah, it's one of the reasons I'm going to put a plug in for reaching out for lactation help before the baby comes.
Yes.
Because if you've ever had a baby and you remember those first few days, if someone said to you, oh, Google lactation in your town and find someone, that's a task that might be above your ability because of all the other things going on for you. So set up a relationship with a lactation consultant before the baby comes. Get prepared before the baby comes. We're all into buying we buy the best carriage. We have the best photo shoot lined up, all the things, right? And nobody's thinking about, we have a birth plan. We have all this stuff, and we're not thinking about how do you breastfeed?
Yeah.
What do I do if it doesn't work? What do I do? And what do I do if it doesn't work? Shouldn't be, then I'll just bottle feed. If you want to breastfeed, you should have the sports breastfeed.
Right. Yeah. And we want to help you on that journey, right? That's why we're here. We want to help you succeed. We want you to meet your goals, right? And so I do feel like it's hard for moms to reach out. I always say, please ask for help. That's why we are both here, right?
Yep.
I also offer services for, I call it 911 breastfeeding support, that you can contact me over Voxer for 30 days with any of your questions, right?
Oh, that's great.
It's always great to see someone in person, but I know there's more than once at 2 a.m. I was rocking my baby and I was like, I have all the questions, right? And nobody's awake at 2 a.m., but go ahead and send me all your questions. When I wake up, more than likely in 2 to 4 hours, I will respond to you, right? And so it's not having to wait on someone to call you back. You don't have to wait to get an appointment in a week, 48 hours, something like that, Yeah. So we're here to help. We want to help you as best we can.
Exactly. And there's so much help now. Like when I was having my babies, there was no help. In my town, I was the first lactation consultant to work privately. And I'm still the only one that has an office privately.
That's surprising.
And that's a borough of New York City. I mean, it's crazy.
Yeah.
So, yeah. But in most places, like if you go over the bridge to New York City, I'm in Staten Island, if anybody knows where Staten Island is. But in Manhattan, it's like you turn around and you bump into a lactation consultant. You know what I mean? Like they're all over the place. It's wonderful, but not so much in even this borough that's so close to the city.
Interesting.
Yeah.
So why don't we talk a little bit about why it's so controversial? I feel like so many people are like, well, you guys have just like created this. It's not really a thing, right? I feel like there's so much controversy right now, if you don't mind speaking into that.
Absolutely. You mentioned that you barely learned about this in school, right? And you're young, right? So
yes, I'm 35.
Probably half of the providers that are working now went to school before there was even a mention of tongue tie. I remember both in my RN, my midwifery, and my lactation studies, there was only information about anterior tongue ties. And they're the most severe, the most obvious, and appear to be the ones that will cause problem. I beg to differ. I've seen posterior ties that cause more problems than anterior ties, but that's a story for another day. So the controversy comes when you have someone who's never learned about something, not understanding the professional role of the people who have learned about it and are telling their patients about something they don't understand. Right. So I don't know if you know Dr. Rajiv Agarwal. He does a lot of lecturing. He's in Arizona. He's got a great practice. And if you ever get a chance to hear him speak, he's a pediatrician. And he was explaining to us at the last lecture I heard from him that we should be patient with pediatricians and realize where they're coming from. So say you had somebody that came into your practice about something to do with their speech, and it was something you didn't know about. And now the parents are saying, yeah, but so-and-so told me about this. And that so-and-so isn't even a licensed provider, quote unquote. right? Because we're not licensed in every state.
I feel like now I saw it on TikTok.
What's that?
I said, now I feel like I hear people say, I saw it on TikTok. What do you think?
Yeah, exactly.
Yeah.
Exactly. So, a little bit of grace, a little bit of patience for the pediatrician, but then I'll go back and say, well, I didn't learn about it in school. And I knew that I needed to learn more. Like these people, even if they read their professional journals, they would learn more about tongue tie. That's again. But the other reason why it's controversial, well, one of the other reasons is, first of all, we had 2 or 3 generations that were not breastfeeding. So nobody saw breastfeeding problems related to tongue tie, because if anybody decided they were going to breastfeed, if it didn't work, it was no big deal, because breastfeeding wasn't that important and it was cool to use formula. So the people taking care of babies didn't learn about breastfeeding, didn't learn how to support breastfeeding, certainly didn't learn about how the tongue functions with breastfeeding. So that's the other reason why it's controversial. I also think that there's a problem with, and I'm very cautious of this, social media diagnoses, dentists and doctors who may be too free at doing releases without a functional assessment are giving this a bad name, because everybody knows somebody who had a tongue tie release and it didn't help, right? You hear those stories all the time. So we're having tongue ties released without a functional assessment, without knowing if it's the tongue tie causing the problem. And that could be newborn to grown up, right? So everyone's running to get their tongue ties fixed without knowing, is it actually the tongue tie or is it something else? So that's giving our field a bad name. So if you have a baby, there's a lot of places where if you can't breastfeed, they'll do the procedure. And you saw in your own son, that didn't help, right? That wasn't the problem. It might have been a tongue tie, but that wasn't the problem that needed to be addressed then. So there's that. So I think it's overdiagnosed and underdiagnosed, if that makes sense.
Oh, it makes total sense to me.
Yeah. And I think the overdiagnosis is what's causing the controversy.
Sure. Absolutely. And one thing I also think about, it's kind of in the same vein. If you think about, someone said to me the other day, which I totally agree with, people aren't coming to lactation consultants because everything's going fine, right? They're coming to us and then we're doing a full oral motor exam and we're catching more of these because, again, moms are wanting to breastfeed. We're getting a little more, can I say, crunchy. This next generation is wanting to breastfeed, which I think is amazing. We're getting away from formula. We're having formula shortages. So, moms are thinking ahead. Yeah, let's breastfeed. So of course we're seeing more of them because we aren't bottle feeding. And one thing I hate to say is, like, if bottle feeding's not working, the thing I've seen the most, which just breaks my heart, we turn up the flow and we're drowning our kids in formula. We aren't finding the underlying problem. We're just turning up the speed. Yeah.
I even I have a blog about, bottle feeding doesn't solve the underlying problem. So I'm not against bottle feeding or formula if it's necessary, or it's your choice. It's totally your choice.
Right.
My platform is all about helping parents meet their own goals, not my goals, of course. Right. In my world, everybody would breastfeed. There'd be no bottles, but no, just kidding. I respect everybody's goals, but if your goal was to breastfeed and you're in the postpartum visit or whatever, and the baby's not gaining weight and the baby's jaundice and the baby's not peeing or pooping and there's a concern, the answer isn't just to give a bottle, because yes, you might have to give a bottle, but that's not going to help if there's an underlying problem, and it actually will hurt your milk supply, because nobody's telling moms to pump if they have to give a bottle. That's, and we could talk forever about
we could.
Lots of tangents we can go on, but yeah. So there's that. I don't we don't know the incidence. And as I often say to the parents who ask me, I only see babies that are having difficulty. I don't see the babies that are doing great.
Mm-hmm.
So for me, 90 to 95% of the babies that come into my office have some sort of oral restriction.
Right.
I'm not sending everybody for immediate release.
Absolutely.
But that's what I'm seeing. So,
Yeah.
I don't know, the latest it's between. The assessment tools are so, different assessment tools rate things differently. So it's hard to have a uniform approach to measure how restricted a tongue is, especially if it's for function, right? So it's hard. It's really hard to know how much is it increasing? It's not new. I mean, any religious Bible or the Quran, the Old Testament, there's all mention of tongue tie and releasing the tongue tie and things like that. And there's ancient tools that have been found, which are dental tools with descriptions of releasing the tie and letting the tie go free,
right?
In different ways. So this is not new in any sense of the word, but there's a generation of medical providers that did not learn about it.
Yeah. So true. Yeah. I love that background. And I also love that, specifically with midwifery, they talk about, the midwives would have a long nail, and every child, they would take the nail under their tongue. So again, they weren't seeing them because kind of everyone was getting that
care
done.
of.
Yeah. Yeah.
Because if on a biological perspective, and I like to, caveat this with no offense to anyone, but we are all mammals, and mammals feed from the breast. And if they don't feed from the breast, they do not survive. So if we had no other way to feed our babies, like say caveman era, whatever, what would we do? We would figure out a way. And if we saw that the baby couldn't move their tongue, somebody would release it and the baby would eat, or we would pass the baby to a mother who had more milk, or, you know what I mean? Like we need to feed biologically, we need to be able to breastfeed as a parameter of health. So even someone who doesn't plan to breastfeed or does not breastfeed, it's still important. It's still an indicator of something isn't working. And it's like the first function, suck, swallow, breathe, right, is the first function that the baby has to do and coordinate. And if that's not working, what else is going on for that baby? We want to make the baby as comfortable, make his function as easy as possible. We don't want to just say, all right, well, this function doesn't work, so we'll try a bottle and we'll force feed them. And then I also have babies that do well on the breast when the mom has a copious supply and can't bottle feed. Right. I mean, I have somebody posting in one of my social groups today, and I'm like, just come. And you ever hear this? You ever see on social somebody that actually came to you and you told them to do a certain thing, and then they're asking the same questions in the social group? Be like, why aren't you listening to me? But I can't say anything because it's anonymous. It's a little frustrating. Like, just read the note I sent you. It's all in there.
All right. So I ask everyone this question: what is your favorite breastfeeding product?
So I'm not your typical lactation consultant that likes getting involved in recommending different things. I'm very, getting back to that midwifery model and keeping things simple, whatever. But the one thing that I suggest more than any other item, especially for babies who have bottle fed and are trying to get back to the breast, is a nipple shield. And I don't suggest that everybody just run out and get a nipple shield without a lactation consultant's help, but it's better for your baby to nurse with a shield than to not be able to nurse at all. And a lot of times it really does. If the shield is on right, if it fits well, because there's all different sizes, and the baby can transfer milk through the shield, then it's a good solution. The danger in that is when a baby can look like they're nursing. They could be suckling on the shield and not getting any milk. So you have to make sure that there's sucks and swallows and the baby's gaining weight and all the parameters for figuring out if the baby's getting enough milk, not just that the baby's nursing on the shield.
Mm-hmm. Yeah.
So that's my favorite product is the Nipple Shield.
Yeah. Awesome. I do have a blog post for mamas if you want to go look on a lot of different types of nipple shields and good reasons why you should use certain ones over the other. But I do agree with Lisa. You should also be working with a lactation consultant to make sure it is fitting properly and they are actually using it, because we never want our babies to be losing weight.
Right.
Yeah. So, well, Lisa, thank you so much for your time today. Super appreciate it. Let all the mamas know how they can connect with you.
So the easiest way is if you're on Instagram, Tongue Tie Experts on Instagram. I'm on there all the time. And I have my own podcast. So wherever you're listening to Bethany's podcast, you can pop on Tongue Tie Experts and my podcast comes up. I have a website, tonguetieexperts.net, not .com. And that was already taken, and lots of information there for parents and professionals. I do have a parents course all about tongue tie, but more important than that is if you are a professional, I have a professional's guide to tongue tie that has a membership aspect and we're learning together. So that's my baby. Like, I love to get people into my course and have a place where we can build a team, you know, and people are connecting and things like that. And if not on Instagram and it's Facebook, then it's the group Breastfeeding Tongue-Tied Babies. And it's a well-moderated Facebook group. It's not like some of these crazy Facebook groups where people are like posting pictures and everybody's giving each other, you know, unsolicited advice. And there, you know, it's a nice, well-moderated, I'm screening every post. It's a great place to connect with other moms, to find professionals in your area. If you're looking for someone in person, if you're a professional and you're looking to meet other team members, it's a great place to connect. So I'm not, you know, I have a love-hate relationship with Facebook, but for this one reason, you can't do that on Instagram. You can't connect people on Instagram the way you can on Facebook. So it works out well. But thank you so much, Bethany. This was really nice. I enjoyed it.
Yeah, I'm going to ask one more question before you go. Sure. So you talked about your membership. I am curious, also as a speech therapist, I know a lot of occupational therapists and others listen. Do you offer continuing ed in that membership?
I have continuing ed for lactation consultants only at this point. However, a lot of people, like different organizations, allow you to submit what you've done and give you credit anyway. The speech language pathologist credits are really hard to get.
We are. We're tricky people.
Yeah. So I don't have that yet, but maybe someday.
Yeah. No, that's awesome. I just know personally, and lots of my friends were always looking for continuing ed. So
absolutely.
Anyways, well, thank you for your time. We super appreciate it.
Thank you so much. Bye.
Thank you so much for listening in. If you loved this episode, it would mean so much if you would share it with another mama or post on social media and tag me. I want to personally thank you for wanting to help other mamas. You got this. I'm rooting for your breastfeeding journey.